So it is a crazy time because we have so many drugs in multiple myeloma now available with numerous combination options. But of course, not all of these options are approved, but still it is sort of a high complexity now. And so my aim in my presentation was to demystify the complexity of myeloma treatment. And I was focusing on frontline therapy. And so what is the current standard in frontline therapy? It is, from my point of view, in transplant-eligible patients, it's a CD38 antibody and a VRD backbone, followed by a single transplant and maintenance. And there is maybe an exception that are high-risk patients, and I discussed the diagnostics of high risk or the features of high risk in my presentation, because this is something which changes over time. And luckily, what we considered high risk a couple of years ago is not high risk anymore because we have so good new novel drugs, but there is still a small proportion of patients, maybe 5%, 10%, who have ultra high risk disease. And here we do not know what to do, and I recommended a tandem transplantation in these patients, and also a good follow-up using imaging technology and MRD assessment with the goal to achieve MRD negativity and imaging negativity in these high-risk patients, and then continue with maintenance therapy. And finally, for the transplant-ineligible patients, I think, and this was also the polling question, DRD is the winner. So like most of our colleagues, they give DRD, DARA, LEN, DEX for the transplant-ineligible population, because this is well tolerated and translates to an overall survival benefit, which is very significant.